We're going to have a quick look at clinical laser applications and laser safety, okay? So we'll just kick off from here. Right, so here are some of the areas that lasers are used within the medical field, right? So we got ophthalmology, dermatology, dentistry, urology and gynecology, surgery and oncology, cardiology. Yeah? It's not a complete list, but that's just some of the areas that the laser is a tool, like any other tool. So in ophthalmology, and they can deal with retinal disorders, so photocoagulation, organ lasers, treats diabetic retinopathy by sealing leaking retinal blood vessels, trabeculoplasty, organ diode laser improves fluid drainage in glaucoma. Then you have this. It's just examples of the treatment: refractive surgery and pathology, LASIK, which is laser assisted in situ. Again, another word that I hate pronouncing. Creates a corneal flap, then uses the excimer laser, which is your UV laser, yeah? And then small incision lenticule extraction, femtosecond lasers. This is something we're not looked at, which is a 10 to the minus 15 second laser, highly minimally invasive. This is a clever laser in that what it does, it's the doctor sets up a treatment plan, you sit in the chair, you look at a red dot, and then AI takes over. AI decides when you're looking at that red dot, and in the time when your pupil can move, because our pupils are never still, it's always constantly moving. But in the time that your pupil can move to the next position, it could have done 400 shots in your eyes. And that's because it's 10 to the minus 15 seconds each pulse. So that's so fast, it's unbelievable. So like in dermatology now, yeah, they target hemoglobin, right? Oxyhemoglobin, that's your vascular lesions, spider veins, birthmark. This is your port wine stains as well. Okay, rosacea, right? So it causes coagulation of blood vessels without scarring the skin surface. Typically, you will use a pulse dilator, that's a 595 nanometers, or Nd:YAG 1064, or KTP, which is at 532. So you can hear that. So that's two visibles and one very near infrared. Okay, that's typically what you want for these kind of things in dermatology. Also, you get pigmented lesions and tattoos. So they target here is the melanin, the natural and exogenous tattoo ink. So age spots, liver spots, then you have all these specialist spots. Amateur and professional tattoos. Ultra short pulses shatter the pigment particles for immune clearance. So it's your body that gets rid of the particles once they shatter them. And the pigment particles that they're destroying is dye pigments, because that's typically what you would have used, in your tattoos. Q-switch rubies, alexandrites, and Nd:YAG. Picosecond lasers are newer. So these are really fast pulse lasers. So you can see your Q-switch typically 4 nanoseconds and so on, along that length of time. Your Nd:YAG tends to be a bit like decades, they're tens of nanoseconds, but again, still equivalent, but they're really good, really fast. Remember, you're doing massive destruction, okay? That's why you're using your Q-switch in a very short period of time. Therefore, no heating of the skin, all right? You're doing explosive work and moving on, and that's it. And then generally what you do is you cool the skin. You'll probably have like a cooling spray that will cool the skin just before delivering the shot. And of course, you have melanin in hair follicles, so you do hair removal and rejuvenation. So you can fire, when you're firing down in the hair follicle, you're trying to destroy the center because it's hair removal, yeah? So these are typical lasers that you use, your alexandrite, your diode, and the Nd:YAG. So dentistry, hard tissue in the teeth. So you use an erbium YAG. The laser, it prepares cavities, so it's drill less. So you're not going to be using drills. You're going to burn your way into the teeth using an erbium YAG, right? And it treats hypersensitive seals, tubules. And then for the soft tissue and gums, you'll use your diode, your CO2 for the various issues that you can have on crown tightening. So lasers finding their way into everything. So urology, kidney and ureteral stones, yeah? So there's a holmium YAG, it's a gold standard, we have about 3 different holmium yags where I work. And they're all fiber. And so you're basically going inside to do your work. Okay, then you have soft tissue, vaporization of prostrate tissue. And that's because then it's a hollow, but again, there are holmiums. And the reason what you're doing here is that you're getting rid of tissue because you're reducing prostate tissue, which is an issue with older men. Typically, the prostate gland starts to enlarge and will block the urethra, so weeing becomes a problem. So you create holes so that urine can pass. That's just one example. So you're vaporizing the prostate tissue using your holmium yag and thalmium. And the new one is the green light. And also it's used on cancerous tissue by destroying it. So gynecology. So that's another thing, genital warts. So it's in lower genital tract. You know, these are all different treatments. It's CO2 for ablation, because with warts, the problem with warts, doesn't matter what kind of wart is, we're not too quick to cut them, because generally you cut warts and they can become something else, typically something cancerous. So generally, if you're going to get rid of them, you want to ablate them off completely. So you can use like freezing. Freezing is one way where you can freeze it and destroy the tissue by freezing, or CO2. CO2 is just brilliant. You just constantly ablate it while just standing there and it's just gone. And you can leave a little depression where, just to ensure that, you know, all the weird tissue is gone, right? And so you can treat all kind of stuff, just urinary incontinence and that kind of stuff, reproductive surgery, going inside, lysis of pelvic adhesions, and CO2, Nd:YAG, and KTP lasers. Now, the CO2 is a relatively long wavelength and is no good going down an optical fiber. So what they have now is hollow fibers which have a hollow metallic tube, which is bendy. And now we're able to bring CO2 down a fiber, so we can go inside a patient with a fiber and deliver CO2 work. So general surgery and oncology, you know, that's basically ordinary surgery and cancer treatment. So the CO2 acts like a light scalpel, which is why I was explained before, is brilliant because it cauterizes at the same time. The diode and Nd:YAG for liver and lung resections, so it can go in. There may be stuff that you want to get rid of and cut out or open up pathways. You can do that. Tumor ablation. So you're basically just going to burn away the tumor, right? And you can put it directly inside of the tumor in liver, pancreas, and prostates, and thermally destroy them from within, you know? So that's one way. You can also do that using nanoparticles of radioactive material. You stick them in, they have a certain given half-life, that is a time before they disappear totally as a radioactive item. And you can stick it within the tumor, put it right into the heart, and you destroy it from inside out. And then cardiovascular. So, you know, it's peripheral and coronary angioplasty, treats complex arterial blockages, pacemaker lead extraction, vaporizes scar tissue binding leads to the heart or veins, and that's typically your excimer fiber laser. Again, we enter from the groin area and we work our way up, and we will use some fluoroscopy, X-ray, to see what we're doing in cases like that. And sometimes the patient will be given something that will highlight their veins so that we can have a better image, you know. There's a word for it, I can't remember it right now. And then gynecology, of course, your lower genital tracts, genital walls. No, we've gone through this. Yeah, we've done that. Okay, so general laser safety in the clinical environment, yeah? So you can get contraindications resulting from treatment. And that is, we've treated a patient and they've developed another problem. And so we need to be able to see what is it, what created that adverse effect. Okay, were they in the sun? Did they go on holiday just before getting treatment? That's one thing. Are they on particular drugs? We may not know about this. So it's good to find out all this you can about your patient before treatment. Even if you're running a beauty clinic, you should know about your patients. No laser treatment should be given to anybody who's been on holiday. or have experienced a certain amount of sunshine. So if they're going to come and have laser treatment, one of the things to say is, can you wear long sleeve clothing if you're going to have treatment on your arms or wherever you're going to have that treatment, it must be covered for some period of time before that treatment takes place. Yeah. And so on, and what drugs they're on, and so on. Then the other thing, staff behavior. You need to develop a good working culture with your staff trained in laser safety. So we do that all the time. What we do is we do quick 1 hour courses. We can go in, we can literally say to them, we'll do it in your lunch hour. You can have your lunch while we're talking to you, and we go through the safety. And so nobody should be in a laser room without first having some form of laser safety training, even if it's just a basic one. They should not be in that room because they have to have an idea how to work safely around lasers. Because the last thing you need is somebody who's going to go in there and they're being flippant, and then they are the cause of the accident. Okay. The environment, you've got to pay particular attention to the environment and make sure that the area is, it's a good working area. You don't want to be tripping over wires or machines. You've got to have everything in the right place so that when you're going to do your work, it's free from clutter and everybody is able to move around. Because, in theaters, it gets really busy. You'd be surprised how busy it gets. And everybody's moving around like no man's business. And so you want it so that there's nothing in the way where you're bouncing against each other in order to get from point A to B. So, and equipment. Most of the incidents that occur with lasers is generally because they haven't been serviced and they're not in good working order, which is why we do quality assurance tests. We always go along, check that it's working within manufacturer's spec. We normally use a meter to do that. The meter we use typically have heads which are black bodies. That is, when you look at it, it's black. And the reason why we choose a very good black is black will absorb heat, but also gets rid of it really quickly. So if you're measuring a temperature with a black body, it absorbs it really quickly. The temperature sensors records it. You get your wattage or your joules, whatever it is, and that head is cooled and ready for the next shot, And so typically, that's the kind of stuff we will use to measure the output of lasers. There are other hazards that you have to be mindful of. Electrical hazards. We tell people, you're not an expert. Do not open a laser. You can't fix it. Because it's highly likely if you go playing around in there, what will happen is that the doctors will be treating you for high voltage burns or you'll be dead. It's one of the two. So don't go opening up a laser. Then there's a mechanical manual handling. A lot of them are large and they're on wheels and heavily and they move around in odd ways. So we always say, be careful of that. Know your kit, know what to do. Chemical, you get your dye and vapor lasers. They're toxic and carcinogenic chemicals. If a dye laser leaks in your theater, you're certainly going to know about it. That smell is going to hit you like no man's business. So my thing is that if you walk into a laser room and you can smell it, the first thing you do, you open the windows, you come out, you close the door, you leave it be, and let it go. And then you call somebody who's responsible for it. Smoke and vapor, always problematic when you're dealing with skin treatments. If you've ever been in a dermatology room when they're doing CO2 work, you will think that you are at a barbecue and they're doing wild boar because that's what the smell is. And the room will be that smoky. So generally what you need in place is you need proper smoke evacuators with proper filters so that you use it at the site where you're working. And that sucks away all of the things coming up from that. Because don't forget, there is bacteria and virus on everybody's skin. And when you're hitting somebody with a laser, that is going to create an explosion. And that's going to put that in the atmosphere. And people have no idea how fast explosive skin moves across a room. It's like half a second to move across a room of, say, 2 meters really quickly. And then you'll be breathing it if you haven't got in the proper breathing apparatus, like your decent mask. And then, of course, there's fire and explosion. So no alcohol. You don't wipe down the patient's skin with alcohol before treating it. You use water. And that's something we have to keep reminding people. Then you have to have laser-proof tubing for anesthetic use. There's tubing that you put down to go into the lung to help the patient breathe when they're in general anesthetic. We've had laser fires from that. And so you have to have the laser proof tubing when you're doing work like that with lasers, and your fire extinguisher. The modern rule now is to get all these foam and powders and stuff. Let me tell you, they all fail at 1,000 volts. And with your high voltage laser, it's not going to work. The only extinguisher that's going to work on your laser when it's on fire is a CO2 laser. And that's because it's a gas that starves that fire oxygen and puts it out. And so just remember that. Okay, so that's your typical hazard. Now, when it comes to laser safety management and setting something up, these are the three areas that you'll cover. There's the administrative area, which is the risk assessment, the local rules, organization safety policies, contingency plans, and training. Then there is the personal protective eyewear. So you've got to get the proper eyewear for each laser, right? And everybody has to wear it in the room. And you have to have high quality and laser standard face mask because if there's smoke, right? And then, of course, you have your engineered controls, door locks, blinds for windows, laser warning signs, and safe laser key storage. You don't leave the key in the laser so that anybody can come in and turn it on. Okay, you put it in a safe space, and the person who's responsible for the laser is the one who will have to be asked in order to retrieve it. And so door locks are important. You don't want people walking in just as you're firing because they're not wearing their glasses, and they're going to certainly, even at a minimum, are going to be dazzled. Yeah. And for your windows, you want blinds because you don't want the laser light going through the window and out into the public. And this is so you set your environment up to be safe as well. So at the heart of laser safety, I'm asking you to research further things. The MPE, which is the maximum permissible exposure. It's a maximum amount of light for each wavelength before it starts to cause damage. It's different for eyes and skin. Your nominal ocular hazard distance. It's the distance you can stand from the source of a laser, which has a beam that is gradually spreading out. The optical density. This is a value listed in laser eyewear to show it's safe for a particular wavelength and power. It's a logarithmic scale. Okay, so the American standard is you might see OD5, OD6. In Europe, you will not only see OD, you will see L, or you might see LB preceding the number. And the number always represents the number of zeros behind the one. So if you saw OD5, it means there's 5 zeros behind your one, which would mean 100,000. If there's 6 zeros, you know it's a million. And that's how many times it reduces the light from the laser going into your eye. Okay. And then, of course, in terms of international determination of safety of laser, is called a class. So class 3B and 4 are the highest classifications of laser output powers, and these are typically the ones you will find in medical environments, including outside clinics. And so these are all dangerous. So typically, you need to be wearing the proper PPE on your eyes for those lasers. Okay, and I hope that was quick enough. Let me just close this.
Thank you so much, Dr. Paul. That was very quick and very, very insightful.
Yeah.
And it has really answered a lot of questions we had. I mean, people asking for what are the PPE for laser lights. The last few slides explained that. And someone also asked the question if wearing dark glasses would actually save from laser lights used in party. But from the last explanation, we can see that there are actually specifications for glasses used for protection against lasers. So
Yes,
that would answer the question to the person that asked if dark glasses will help. No, it's not going to help because there are specific
that's
glasses,
right.
specific glasses for laser protection.
Yeah,
Okay, thank you so much once again. So this goes to all participants. We will be putting a link in the group chat, in the chat box. Please kindly fill the Google form, and that's going to be as an alternative for people that were not able to fill the poll earlier. So yeah, we're just going to leave it there till the end of the meeting. So you're not having any network issues or anything. Please fill and for people that were able to answer the poll too, please also do well to fill the Google form. Thank you. So I'm just going to go ahead to the next couple of questions we have.
good.
So we have one question. It's probably related to the physics of lasers, but I'm just going
Okay.
to ask that. So someone says, if I assume that all lasers have different specification, should I also consider that the absorption coefficient depends on the laser that we are using?
Of course, 100%. So your laser absorption is totally dependent on the wavelength for a start, okay, and depending on the type of tissue. All right. So this is one of the things that we have. So, for example, when doctors are using it, if they're treating a particular site which might be at a particular depth, and they know that that wavelength is going to get to that depth through that particular tissue, then they might have to up things like the amount of power, the width of the beam, because they want more light to get to that area because they may be facing scattering on the pathway to the area where they're going to hit. And so it's a clinical thing. So everything is learned, if you get what I'm saying. It's learned with a little bit of trial and error. Medicine is never perfect, okay? Especially when using lasers. There is a general thing that you can do that will work. But every clinician I've known, all of these doctors who I've known who've been working with lasers for years, if I'm in a room with them and they're treating a patient, a new patient, you will hear them saying, I just want to try this, or I just want to test that. And that's because they're not going to take chances and make an assumption that this beam is going to make it, you know? So yes, absorption coefficients is very important depending on wavelength.
Thank you so much, Dr. Paul, for that answer. Very explanatory and quick to the point. So someone asked a question earlier, which I feel you've also answered about knowing the different fields where lasers can be used. You've answered it in this just concluded session. But the second question to that part was, when we buy the different laser equipments, do the vendors provide some training on how to handle some minor issues? I know you've also explained like basic
Yes,
safety procedures, but do the vendors
yes.
provide them?
Yeah, so typically, we found that if the vendors are dedicated laser suppliers, they will supply some training. One, they have to supply training. Remember this, they've got to supply training on how to use a laser.
Yeah.
That's a standard training. Yeah. So the day when they come along and they put the laser together, maybe the day that they will also agree to say, we're going to show you how it works and how you can dial up the different values. And typically, those guys who do that will have some idea of how some of the treatments can be done. Okay. So they'll tell you, when you're using it at 100 milliwatts or you're using it at 2 joules, whatever it is, it will have this kind of effect. But there's normally an application specialist who is associated with a company. And that's what you might sometimes have to pay a bit extra to get that person in. But I would say that person is invaluable because once they come along and show you what is needed, you'll have a good idea of how to use the laser. Not knowing how to use it at all is kind of terrible. So, and interestingly enough, we've had application specialists who've come in with fruit. They've come in with apples and oranges and pears. And the reason is, if you think of an orange, it's got a thicker skin. Okay,
Yeah.
it's got a skin which is about, say, 4 millimeters thick minimum. Yeah. And then they have a pear, and a pear is like 1 millimeter to 1.5 millimeters thick. And then you have an apple, which is a little bit, it's kind of thin too, but it's not as soft as a pear. And then they fire the laser on it. They fire the laser on it and show you its actions. And what they're showing you is different skin. Because
Mhm.
if you think about it, if you have a young person, their skin is going to be much more supple, uh, more tight, yeah, and all the rest of it. And an older person's skin will be a little bit more worn, if you like, yeah. It's approaching much older leather, if you like, yeah. And so we'll have a different effect. And by using fruit, believe it or not, and firing on fruit, they get a good example of depth, how far down into the material that laser will go, right?
Mhm.
They get an idea of how quick it is to burn, how wide is the field, and that's a very good training mechanism, I think. I thought when that application specialist, who was a doctor, yeah, she was a surgeon, plastic surgeon, who is working for the company part-time and comes along and teaches. I was totally impressed that they would use that methodology to highlight what skin can be like. Yeah. There's also the application specialist who will agree to come with you on your first case when you're actually going to do somebody and will be there to guide you in doing that. Again, those are people you have to pay for. Yeah. They have the relevant experience and so on. Hospitals are a little bit different. If you're in a hospital and you have a surgeon who uses a laser before, the next best thing to do is to get in with him and be present during all his treatment. Because at some point when you're there, after a period of time, he's going to ask you to try. Yeah, because you've
Yeah.
witnessed it, so try. And that's how doctors teach doctors. So if you're being taught by another doctor, that's perfect because
Yeah.
they're well on the way to seeing how things work. And I hope that answers the question. But yes, you do need an application specialist.
Thank you so much. So we now know that we need an application specialist. So
Yes.
there's a question I asked. So what would be the responsibilities of medical physicists in
So
the
in
lasers? Do
laser
we do
safety, yeah?
QAs, QCs? Like, what would be the role
That's
of the medical
correct.
physicist?
So typically we do QCs, yeah? All right, my service that I offer is a little bit different than most hospitals, okay? And that's because we've been doing lasers for years and we started out from the beginning. You know, I remember so many lasers that have come through my hospital have been prototypes. So we've had prototypes from Candela, Luminous, quite a few of the big companies, and we're still having prototypes coming in. And that's one of the reasons is one is that they know we're very laser capable, and two, um, if they manage to get to say Guys and St. Thomas's uses it, it's almost a green light for every other hospital to use it. It's oh well, Guys and St. Thomas's are using it because we're one of the first foundation trusts. We have huge scientific background. We had one of the leading skin places, dermatology departments on the planet. It's called the St. John's Dermatology. It's old as hat. And these guys have been doing it from youngs. So we have guys who've worked in private sector that's come over to us. We've got a whole range. There's a series on telly. I don't know if you've ever seen it. It's called Bad Skin. You might, because I know it's international because I've seen it come up in other places. And it's a series about this doctor who's working in this private clinic, this lady, and she's treating all these skin complaints. And it's kind of gone global. She works for us. Yeah, she's one of our doctors, but she has a private clinic. So a lot of the doctors have their own private clinics. Yeah. And so as medical physics, what do we do? Well, we do our best to ensure one, that these equipment are serviced. So in our medical physics section, we have a section known as clinical engineering, and clinical engineering ensures that every piece of kit we have in a trust has some kind of service contract. That's what we do. Two, as the laser people, we go along and we will QA them, make sure the QC is showing that this instrument is working within specification. We look at things like the eyewear, make sure that they're not broken, they don't have scratches and stuff like that. We give advice on their eyewear because we will do the calculations for them. We don't let the clinical staff do that. You can't just go and buy eyewear. We do the calculations and make sure that they get good eyewear. But we will offer them a range. So we can give them a range and say, which one do you like? Because you got to think of things like comfort. A doctor is going to be working, he's going to be working for like how many hours on a patient. You know, I've seen laser treatments where it's 600 shots, and each shot is like boom, boom, boom. So you think at the time that that doctor is going to be there. So you want to prevent things like eye strain. You don't want flashes that is just about normal for the eye, but enough to keep giving him a flash. He's going to have strain, and you don't want to do goggles which are just all wrapped like this, which is going to cause them to sweat on the inside and become uncomfortable. You want the clinician to be very comfortable in a good zone so that he gives the best treatment. Yeah. So there's things like that that we cover as medical physics. We kind of are in the background supporting and making sure everything goes smooth. We also put in place the local rules for them. We tend to write their local rules and their risk assessment. We go along, if they're going to use a room and it's the first time, we go along and make sure the room is acceptable. So if it's got windows, they got to put blinds in. So we get the works guys to come and put the blinds in. We'll put an adequate lock on the door. With theater environments, I don't like locks. Nurses have to go in and out. So we want the laser lights and signs to say, don't come in. There's laser procedure at the moment. But we want it so that the nurses can go in and out to go and get instruments that are not already in the theater. So you have to be practical and you have to develop a good working culture. And you help them by doing the training, laser safety training, warning them of all the issues that can happen. So everybody in the room have to have that training. That's medical physics. Yeah, and that's the support we give. We also give an additional support. Our additional support is we do a first point call. As engineers, we can do that. So they say, it's not working. You go along, you find out the doctor's not familiar with the kit. He's normally used to turning the key to turn it on and the laser work. Somebody switched it off at the back. Yeah. And this is when you get your revenge. You can toy with them. For example, I've been on calls where it's not working. And so I knew the switch was off at the back. So I hugged up the laser machine and I said, oh, please, I love you, laser. Please work for me. And I switched it on secretly. And then I turned it on with a key. And he was like, no, no, no. And so, it's bringing a laugh into your job. But you do things like that, But yes, so you got to get familiar with the kit, because sometimes you might have a new user and they're not too familiar. You got to help them out in that way. I hope that answers the question.
It does. Thank you so much. We know that we are currently out of your time, but would you be okay to
I'm all
still
right.
answer
I'm all
more
right for time. I'm okay for the rest of the day. So it's fine if you want to ask questions.
All right, sir. Thank you so much. So just a quick question. Are lasers used in radio diagnosis? And if yes, to what extent have they become used in radio diagnosis? Like, are they used any in diagnosis of any kind of disease and radio diagnosis?
Absolutely, absolutely. So, so many lasers I've seen. So, Raman spectroscopy is one area. So, the Raman spectroscopy is when you use a one wavelength going in, and the material that it goes in, it shifts the spectrum when it's coming back out, which you then receive. Okay. And that can typically be used on your skin. It's going to be low powered lasers, those. So they use that. There's one being built by this fellow who's working with the university at the moment. And they simply shine it on the inside of your jaw at the funny cells that they've been finding in there. And that quickly determines if the cells that are present there is cancerous. Because once you chart things and get back their footprints, and light is brilliant for giving you footprints. Yeah. So if you want to use, say, a multi-wavelength thing, and you receive back the light, and laser light is effective in this because it's all coherent and it's going into the area. It's going to have a single effect. So you're not using this dispersed light, and it comes back and you read back the results, and you get a nice spectral footprint of it, what it's doing. Then you kind of see if it's different from the ordinary tissue which is there. So of course it's about collecting data. So first you collect data from normal, you collect data from disease, and you can then compare the two. Once you're looking for the footprint, then you can use it for diagnosis. Yeah. So yes, it's used like that. Where else is it used in terms of diagnosis? Response. So you may see something, you hit it, and what you wait and see what the injury's healing response is. That's another way to diagnose, because you already know if it was normal skin, how it's going to heal. If it's abnormal skin, it's not going to heal normally. And so you're going to see that as well. So I think the uses for it is becoming more and more. But I would certainly say at the heart of it is Raman spectroscopy. And that's a separate physics, but it generally uses laser light, and that's a good way of doing diagnosis, but mainly on skin tissue.
Okay, so thank you so much for the answer. So we have a question that has arisen again. I mean, you talked about it briefly, but based on the question we asked during the poll session, which is, so does laser cause cancer?
Does lasers cause cancer?
Yeah.
So the only way a laser would cause cancer, right, is if you were to constantly expose yourself to a UV laser for a significant period of time. Yeah. Cancer is a strange one. Okay. So what we find with cancer cells is they take time to develop. So, for example, our biggest cancer-causing thing then that we use currently would be X-rays, okay, or the Linacs that treat cancers. That's the one thing. And what's the risk on that? It's really low. So a typical chest X-ray is equivalent to one transatlantic flight. So if you're flying from, say, Western Africa to the United States, that's equivalent to a chest X-ray in some cases. Yeah. How dangerous is radiation? Well, light radiation is going to certainly be so much less than X-ray, because X-rays are the ones that will do the damage. If you have the lower energy X-rays, they're going to be totally absorbed in there and they will look to cross. Remember, the reason why you will cause a cancer is because of a mutation. And the one way of getting a mutation is to disrupt the DNA. That's how you create it. By disrupting the DNA. You've got to disrupt the DNA in such a way that it doesn't repair itself. The DNA, when it repairs itself, doesn't repair itself accurately, so it does something wrong. And that's where you get your issue. So using lasers, typically day to day, will not give you cancer, no. I hope that answers it.
I think she's frozen.
Yes, I think
Yeah,
so
she's
too.
frozen. Okay, yes, but it answers it quite well.
Okay.
And it appears that when we did the poll, the ratio was 64% to 32%, or 64 to 36, which some people said yes, some people said no, that it couldn't cause cancer. So the way you've answered it also shows that probably we are in the right to think that it can cause cancer, but it's a very extreme case, from what I understand.
Yeah,
right?
it would. Yes, I will say it will not cause skin cancer. Not unless, just imagine, if you went for a set of treatments and say, typically there will be 6 treatments max in all, and you were being treated with an excimer laser, it would not be enough to cause cancer.
Okay.
So the only way it could cause cancer is you had some chemical in your body or on your body, and the light triggered it to do some kind of damaging thing. But no, it will not cause cancer. Do not believe it will cause cancer. Trust me. 25 years I've been with it, and I have not had any cancer. Let me touch some wood. I've not caused any cancer to myself using it.
Okay. So the correct answer should be no.
No.
Okay, thank you so much, Dr. Paul Deacon-Smith.
Right.
It's been an interesting conversation today on lasers. It's a whole new, different area of physics. I don't think there is a proper part of our curriculum that addresses lasers properly throughout our undergrad and postgraduate.
You're 100% right. You're 100% right.
Yeah.
So there is. I'm just thinking, I will tell Ayabosa what I know, how to help you along you guys' way, yeah? So I think the first start is the MHRA document, which I will send to her and hopefully she will dispatch to everybody. I think that's a good starting point. Another thing is, a lot of people don't examine stuff like the international organizations that we have. I'm always amazed by the information that you can glean from them. So, for example, working with radiation, the IAEA has lots of documents up there. I'm not quite sure if they covered anything on lasers. I can't remember looking about that. In terms of standards and information like that, it's normally ISO and British standards or American standards. So, and another thing is find the laser institutions. Go online and look up laser institutions. They always have a huge amount of documentation that you normally can download to look at. And so if you're setting up a service, there's lots of good hints through those organizations, how they did it and why they did it. And so we have to look at our international bodies because they generally are a really good source and they keep abreast of all the international agreements and what's best. And generally, medical associations are quite good at that. If you can find laser medical associations, that's quite good too, because they will have very good information and stuff like that as well. But I will certainly send the MHRA document through to ISO, and hopefully everybody will get a copy, because that's a good starting point.
Thank you so much, Dr. Paul.
It's been a pleasure.